This video is about the Hydatidiform mole. Hydatidiform means a drop of water and mole means shapeless mass. So coming to the features of the Hydatidiform mole, they have the chorionic villi which are enlarged edematous and hydrophic change is seen in this villi and they become vesicular. And also there is circumferential trophoblastic proliferation around these villi. So there are two types of trophoblast. There is syncytiotrophoblast and cytotrophoblast. So we know that syncytiotrophoblast produce beta HCG, that is human chorionic gonadotropin. Just remember that syncytiotrophoblast will produce beta HCG. And coming to the types, there are two types, that are complete mole and partial mole. Complete mole has more probability to get into the choriocarcinoma, whereas partial mole almost never develops into choriocarcinoma. Now coming to what is complete mole and partial mole. In complete mole means there is a fertilization of a sperm which has 23X, that is haploid number of chromosomes, with an empty ovum which does not contain any nuclear material or active nuclear content. Whenever this gets fertilized, the chromosome of the sperm duplicates to form a diploid homozygous complete mole. Means only paternal product is present in the fertilized product. Okay, that is 23X, the sperm fertilizes with empty ovum and the chromosome of the sperm duplicates and forms 46XX. This is called homozygous complete mole. And next there is another type of complete mole in which two sperms will fertilize an empty ovum. In complete mole we should remember that there is empty ovum, no maternal chromosomes. So after fertilization there is 46XX or 46XY. So it is also diploid. So complete mole is always diploid. Next, coming to partial mole, it is a triploid. How? Because there are two sperms which are fertilizing with normal ovum. Here there is empty ovum in complete mole, but in partial mole we have normal ovum and two sperms will fertilize this. So there is a triploid product, that is 69XXX. Whenever these two sperms have 23X with normal ovum, then 69 triple X will form. Next, or there is 69XXY whenever one sperm is 23X and one sperm is 23Y, and 69XYY when two sperms are 23Y. This is very rare condition. Okay. Next, coming to the morphology of these moles. In complete mole, when we see grossly, the uterus is enlarged due to filling with the grape-like vesicles. There are 3 centimeters, have clear watery fluid. So these grape-like vesicles are nothing but the chorionic villi which are enlarged with the, which can be seen as grape-like vesicles. And in complete mole we can't see fetal parts. Okay. Coming to the microscopy. Okay, I will show you the gross morphology of complete mole. You can see grape-like vesicles in the uterus, and see, you can see these are the grape-like vesicles. Coming to the microscopy, there are large round edematous villi with cisterns, that is grape-like, and around the stroma is having less vascularity, and around villi we can see increased trophoblastic proliferation, that is both syncytiotrophoblast and cytotrophoblast. You can see here there is these are the villi. In the cut section we can see hydrophic villi core, and around these villi there is increased trophoblastic proliferation. So in trophoblast we know there is syncytiotrophoblast and cytotrophoblast. These syncytiotrophoblast, I said that they will produce beta HCG, that is human chorionic gonadotropin. So due to increased proliferation there is more beta HCG in this this type of molar pregnancy. In the serum of the patient there is increased beta HCG level, so it causes hyperemesis gravidarum, means increased morning sickness. Okay. And coming to the partial mole, when we see grossly, the uterus is smaller and there are few cystic vesicles of the villi, and fetal parts are present in this. Okay. Remember, fetal parts are absent in complete mole, but they are present in partial mole. When you see microscopically, villi are edematous and trophoblastic proliferation is only slight.